Good morning, everybody, and welcome to another exciting episode of the Spinal Corner with Dr. Joey Kramer, where we discuss matters of health related to the upper cervical spine and your current presentation of a symptom, a disease, or an illness. And one thing I want to dive into today is the construct of a debilitating disease called Meniere's disease. And if any of you do a quick Google search, you'll get an AI-generated prompt, because I just did this myself, that will tell you that Meniere's disease is a disease of the inner ear, right? And it is characterized by a triad. That triad is going to be a sense of unease, right? Balance disorders with a loss of hearing, right? That's going to be involved, typically unilateral in nature. And you're also going to be having some form of ear fullness presentation, right? And when you look at this, there's a lot of unknowns about Meniere's. And having been in taking care of Meniere's patients for roughly 6 or 7 years now, yeah, there is a lot of unknown. There's a lot of struggle. There's a lot of challenges, right? A lot of you are very sensitive to the weather. You're very in tune with pressure fronts. You're very aware of stimulants or things that cause you to spiral out of control. You're very aware of stressors. You're very aware of all these various characterizations of situations that may cause your neurological presentation of a disease to cause it to fall apart. And over the years, I've learned that there are multiple westernized medicine approaches to handling Meniere's that many of you have come to, that some have great success and some not so much. And when we look at that successes, like you may see it as, hey, I got an ITS procedure done and I still have my hearing, which is really awesome. That's incredible. That's amazing, right? But some of you may have tried other things for the vertigo that don't work, right? Like an Epley maneuver, right? Maybe you've gone into, work hardening or balance or vestibular reconditioning, and nothing really, tends to help you get better. And so with that being said, I'd like to provide a alternative lens to you today about Meniere's disease and how long-term success in managing it can be done with upper cervical care. You see, most of the study is looking at how well your middle ear is working and its integration with the vestibular system. And so while we may benefit from some form of, topical steroid or some type of injected steroid to the ear, that's more of an anti-inflammatory approach, right? And you're looking at the eardrum, you're looking at the middle ear. Some of you may get a cochlear implant. Some of you may get some form of, middle ear. Like I think they do like a replacement of the stapes now. Like that's pretty incredible what they can do. However, I want to draw attention to an area that is often overlooked when navigating Meniere's disease, and that is going to be your upper cervical spine. And so if we look at this, right, so here's this is me looking at you right now, right? This is my top of my neck. These are the top two bones. And your ear, this is your mastoid process, ear canal sits right here, right? And like there's this whole big mechanism that comes in here. And this is the back of the brainstem that trends down and originates at the formation of the spinal cord at the first, right, and second bone of your neck. And when you are presenting with Meniere's, oftentimes it's a combination of a yes and, in which you will also have a upper cervical presentation. And what that means is that there are many symptoms that you may have that are masked as an underlying upper cervical problem, right? Most of my Meniere's patients also struggle with anxiety, mainly because they don't know when the next episode is going to attack. Many of them have some issue with their heart rate or their blood pressure, right? Because these autonomic issues, which is a sign of, vestibular, which that's going to be your balance and dizziness. Your heart rate is going to be a little wild. Blood pressure could be a little crazy. You could be having issues with looking up or laying down or turning over a shoulder or driving a car, right? Or a pressure front blows in, where in Texas storm season happens, right? All those things are contributors to showing us an abnormal response to an otherwise normal stimulus. And what that simply means is that your neurological coordination of your brainstem, which is mandated or controlled by the positioning of the first and second bone with the base of your skull, is not functioning properly. And so when you are suffering from Meniere's, and when you've gone down the route of multiple ENTs, and you've gone on the low sodium diet, you guys have tried the beta histines, you've tried to switch over to a different type of food allergy, and you're still having residual issues, you more than likely have an underlying neck issue that is a upper cervical problem that is manipulating or manifesting you as a Meniere's presentation. And so my challenge to you is this, is that if you do have Meniere's and if you do suffer from this horrible condition, you can actually find long-term relief free of drugs or surgery with the upper cervical approach. Because our goal is to evaluate the integrity of your neurological state. It's not to prevent a Meniere's attack, nor is it to heal you of Meniere's disease, right? Because that is incurable in the language that is used by westernized medicine. However, if we were to create an optimal internal environment that allowed your nervous system to properly regulate blood flow in and out of the brain, drainage of cellular waste out of the brain, and cellular nutrition into the brain, that's called your CSF circulation, and proper venous drainage out of the system, while allowing nervous system signals to flow free of impediment or interruption, we can create an optimal environment for you to thrive. That doesn't mean that a Meniere's attack won't happen down the road, but they will be few and far between, because when your nervous system is performing optimally, the likelihood of you having a symptomatic presentation of a neurological disorder is very, very low. And so our goal in the upper cervical world is to assess you for the signs of a nervous system dysfunction. Right? You do come to us and you do tell us, hey, I have Meniere's disease. It's right-sided. I got ear fullness. I have loss of hearing in that ear. I get vertigo when I look up, or if I lay flat in my bed, or if I lay on my right side. So what's a big win for me? Well, I can't do much about the hearing, right? I can't say that we see a change in hearing, but I can tell you we can't do that. But the vertigo side of the life of the Meniere's is more than likely an upper cervical problem. And when we correct that problem, you no longer have to lay down, propped up on 15 pillows. You can actually lay flat in your bed. You can lay on your right side. You can drive your car free of fear of getting a dizzy episode, because you will have the ability and the trust and the confidence in your body to perform the way it's been designed to perform. So if you are diagnosed with Meniere's disease and you are looking for an alternative in the Dallas-Fort Worth area, Hope Upper Cervical is conveniently located in Southlake, Texas. And we always provide a free consultation to help you navigate Meniere's in a holistic and alternative method, free of drugs or surgery, free of those, obliterating drugs that make you nauseous, that make you feel tired, fatigued, foggy, all those things. We can do this in a very holistic and natural way, a way that gives you quality of life, that allows you to thrive and not just survive day to day. I hope this is an educational message, and I hope you begin to grasp a basic understanding that the neck, especially the upper cervical spine, is so important in regulating the entire neurological presentation of you. It's not just related to what's going on at the site of the symptom. Oftentimes, it is a referral from a greater problem that exists, and that underlying problem is at your upper cervical spine.